What is going on, everyone? It is Thursday, September 11th. We're going live here on YouTube. I'm also on TikTok. I hope you're doing well. What's going on, everyone? MappdCon this weekend, Saturday, all day. I hope you are hanging out with us. Cancel all your plans. There's nothing else you should be doing other than hanging out with us for MappdCon.com. I want to answer some questions. I want to hang out. I want to chat with you all. How are you all doing? What's going on, my friends? I don't go live enough on TikTok. But here I am, ready to rock and roll. How's everyone doing? Hello, Julia B. What's going on? What's going on to YouTube? Let me get these questions. Questions already rolling in. If I have 200 shadowing hours from consistently shadowing during undergrad over 4 years, should I just put one date over 4 years or multiple dates for each physician specialty on my app? There's no specific rules when you're creating your application in terms of splitting it up, not splitting up, all that kind of stuff. My general suggestion, if it's consistent over those 4 years, put the start date, put the end date. Don't separate it into separate dates. And then in the description of that activity, you just list all of the physicians. So it's like hyphen, right? A little dash, Dr. Smith, orthopedics, 300 hours, these dates, this contact info. Dr. Johnson, family practice, these dates, these hours, contact information. Should be good enough. What's going on, Josh? Hope you're doing well. Madhu, hello, sir. Psychic. Kit. Third year med student here. What advice do you have for choosing a specialty? I know it's not necessarily pre-med. Yeah, I mean, we are in the residency game now. If you haven't heard the podcast Med School Years, that's on episode 12, just came out. So check that out. That's a whole new thing. Julia B, current third year med student here, truly because of the help and advice you put out. Thank you. You're welcome. Thank you, Julia B. That is awesome. Josh, procrastinating, studying. Yeah, all the med students, get off my stream. Go study. No, come hang out. I love you can give your advice as well. Yeah, so for specialty, here's my general advice, and it'd be interesting, Julia, as you're going down this path, Josh, as you're going down your path to figure out a specialty. One of my big problems with specialty choice is that students choose the specialty that they are competitive for, not the specialty that they want to do. You choose the specialty that you're competitive for. How often have you heard, Julia, maybe you can chime in on this, although it's different now, right? Julia, you're third year, so maybe your students, your classmates haven't taken step 2 yet. With step 1, pass, fail, that decision kind of gets pushed to step 2. Historically, we have heard, oh, you got a 250, you got a 260 on step 1. You should go to dermatology. You should go to radiology. You should go to whatever specialty matches that score. And so students, I believe we have a lot of physician burnout for lots of reasons. But I think one variable, however big it may be, is that physicians chose their specialty because of their step score or scores back in the day, not because of what they were passionate about. And so as you're going through this, you really have to understand that every specialty gets boring. Right? As you're a med student, as you're a pre-med student, it's all super exciting. You're like, yeah, this is amazing. Blood and guts and gore. And like for emergency medicine people, and maybe not the right analogy after yesterday. I apologize. But you have to understand that the sexiness of the specialty that may initially draw you towards it isn't sexy anymore after a while. And so you have to be okay with the boring stuff, the bread and butter that the term that we use in medicine, the bread and butter stuff for that specific specialty. You have to be okay with a full clinic of all bread and butter stuff. And all of the zebras that you saw during medical school because you went to a big academic medical center that kind of was a big encatchment for a huge area where all of the cool stuff came. You have to be okay with the bread and butter. And if you're not okay with the bread and butter, you're not going to like your specialty. So go there. Good question. Thanks for that. I love talking med school stuff. It's just I don't talk a lot about it. So let's talk about it. Ben, do med schools care if your clinical experience is paid or unpaid? Historically, Ben, we have said it doesn't matter, paid or unpaid. Back in episode, let me pull it up here real quick. Laurel Poole, I think is her name. UCF. The director of admissions at University of Central Florida. I'm trying to pull it up here. That's so weird. Why isn't it pulling it up? Oh, it's because I put a space there. Duh. The director of admissions, it's episode 561. So premedyears.com/561. That is an episode I did with the director of admissions at University of Central Florida. And she stated, like, our admissions committee place value on unpaid clinical experience. I personally disagree with that. That comes with some privilege to be able to do unpaid stuff, but that's their choice. I'm glad they told me. So now you know, right? That UCF places some value on unpaid clinical experience. I don't think that's the standard everywhere, but that's one school. So whenever I speak and give answers, I'm trying to speak generally. And yes, there's always, right, if you think of a bell curve, there's always going to be the outliers. But in general, the majority of the conversation that we have, I'm speaking to the core of the bell curve. Does hospice count as clinical? Heck yeah. All right. Let's see. Ba-ba-da. Did you take the U-Shoes route? U-Shoes, whoever you're talking to? No, I did the HPSP scholarship. Dr. Gray, 7 years as an IDMT. Is that enough patient care to not keep adding hours during a post-bac? I am generally not a fan of just stopping. Now, obviously, if you're doing a post-bac, that probably means one of two things. Either you don't have any science classes or you have science classes and you need to improve your grades. Obviously, if your focus is on doing well in your classes, focus on your classes. And if you can, try to volunteer once a week in hospice or once every other week in hospice or once a month in hospice. Try to maintain some level of whatchamacallit, some level of activity there. Can you expand on what it means to create a narrative or theme to your application? Any tangible examples would be really helpful. Thanks so much. I can't expand on this because I don't agree with this thinking. A lot of people will recommend having a theme. Guess what the theme is? You are your theme. So I don't believe in like coming up with some external theme that everything has to tie back into this theme. I generally find that when I'm reading an application, when you read enough of them, you realize you know when a student is setting you up for something. And so if you watch any of my application renovation videos, which we're going to have more soon, stay tuned. I'm going to record more. If you watch any of my application renovation videos, you'll see me go through this. And I will say, okay, here, this student is saying this. So what I'm going to expect in a couple lines is this other thing. And then I get there and I'm like, see, I told you, they set me up. And when you force a narrative or you force a theme, then all of a sudden everything starts getting forced into this narrative, this theme, when ultimately the theme is you. Who are you as a person? What are your passions? What are your interests? What do you want to do? So can I expand on it? No, because you shouldn't be doing it. At least that's my advice. How do medical schools view institutional actions? It really just depends. I know AMCAS just made a change last year, I believe it was. If your institutional action is removed from your transcripts, from whatever sort of report your school gives, you no longer have to report that to AMCAS. Go verify, go check the instruction manual, the applicant guide, make sure that that still holds true. But it's pretty awesome. All right. When should you start worrying about interviews? Submitted secondaries throughout July and nothing. So Spartan 101, when should you worry about not getting interviews? Historically, we say if you're not getting any action by Thanksgiving, then there's something to potentially start looking at. Although generally, I would recommend as soon as you submit your application, you start worrying about the next application. You start trying to critique your main application and go, what could be the problem here? Where could I have some gaps in my application that schools are not going to like and I'm not going to get any action, right? It sounds a little counterintuitive to submit your application and spend all that money and be super hopeful about what's to come, while also saying, oh, by the way, let me see why I'm not going to get into medical school. But I think that's really strong to a strong action, a plan, so that you are immediately working on any potential weaknesses in your application, just in case you need to reapply. So back to the institutional action. I know I was kind of short with that. It really just depends. What is the institutional action? Is it the common one of like, I got an institutional action for drinking on campus during my freshman year? That's the most common one that we see. It's not a problem. If you have multiple institutional actions all pointing to the same thing of like, you haven't learned your lesson, then that is a problem. So don't do that. Green23. I like your username. It sounds like a quarterback call. Green23. Medical school or MappdCon.com. MappdCon.com. Come hang out. Saturday, not Friday. This Saturday, 2 days. Come hang out with us. Green23. I took 2 gap years to do RN school after my biochem degree, but need LORs, and I'm sure how to ask. You just need to ask. You need to start building a school list or start exploring a school list. Look at what letters of recommendations they require, the schools, because it's the schools that build the requirements for LORs, and then you go get the LORs you need. Barry Jones, 4th year in college, trying to apply next cycle. What can I do to prepare myself? Check out my book, The Pre-Med Playbook Guide to the Medical School Application Process. Oh, this one here. Oh man, it's green. So hold it. There. If I hold it just like that, it doesn't like it. There you go. For YouTube, I'm holding it up to my phone over here for TikTok. This one on YouTube. Darn green screen. Yeah. I think at the end of the day, that the first question for anyone who is thinking about applying next cycle is, am I ready to apply? And was that English? Am I ready to apply? When you ask yourself that question, you take the pressure away from I'm applying next cycle, and you're now in investigative mode of trying to figure out, are you even ready to apply? Is your application competitive if you do apply? And I think that's the first step, that mostly goes out the window. As students are just like, oh, I'm a junior, that means I should apply. Or, oh, I'm a senior, I don't want to take 2 gap years, so therefore I'm going to apply my senior year, end of my senior year. And the actual question of, are you even ready to apply, goes out the window. And so I think that's step number 1, is figuring out, are you ready to apply? If you, all right, so I'm going to trust you guys with something. Let me just double check. I'm going to trust you guys with something. For those of you who, for those of you who will be applying this upcoming cycle, if you go to readinessreportcard.com, I haven't talked about this publicly yet. If you go to readinessreportcard.com, I'll put it in here, the YouTube link, readinessreportcard.com. There may be some bugs. I haven't played with this in a couple of weeks. We've been delaying pushing this out because I'm scared to push it out. But partly because right now, all of the scoring that's built into readinessreportcard.com is built on, you have your GPA, you have your MCAT score, you understand kind of where you're going to be in the process in terms of what you're doing. And it's not yet built for a freshman or a sophomore. So if you are applying next cycle, check it out. If you don't have an MCAT score yet, go ahead and predict an MCAT score. And this isn't a tool where you need to like try 20 different versions of it. The readiness report card, it'll ask you about clinical experience, shadowing, community service, research, leadership. It'll ask you GPA, MCAT score, and then it will email you a grade of what we at medical school headquarters, we spent a long time building out kind of a rubric to grade whether or not you're ready. So back to the gap. I don't know why I got started, right? The readiness report card is there to help you figure out, like, are you even ready to apply? So we think about how much clinical experience do you have? How much shadowing do you have? How much non-clinical community service do you have? How much research do you have? What are your grades? What are your MCAT score? There are so many questions about your readiness when it comes to apply. If you want, right, we have a team of advisors. You can spend a 30-minute or a 50-minute call with them and just lay everything out on the table, so to speak, and have the advisor go, yeah, like, I'm comfortable with you applying. I don't see any huge gaps. Or you do have a gap, and I think if you start trying to fill in that gap right now, you're going to be fine. Or they may go, I have a lot of reservations about you applying next cycle, and here are the things to work on. Oh, man. Barry Jones, 3.4 upward trend, 2.4 high school, 305, 293, 339, 39, MCAT 508. Grade-wise, do I need a postback? I think you have a 339 to a 39. Depending on how many credits those are and how much of that is science, you may still need a postback. And so this is where it's just, there's so much nuance here. The fact that you only have that 139 semester or year, depending on how much science is there, how many credits are there, we may recommend some more science courses to keep that trend up. 349 GPA, upward trend, 6,000 clinical hours shadowing, volunteering. How do I look? I mean, this is the most common question we get all the time. Is like, what are my chances? Tell me about myself, or tell me what my chances are and how I look. It's impossible. And I'm not saying that to be like, oh, you should come work with our team. Like, I'm telling you, it's impossible. So a 349 GPA, I love that number. Let's just call it a 3.5. You say you have an upward trend, but what does that mean? Is it similar to the last student where it's only 1 year has that upward trend? Or is it, and I love 349 because we can call it a 3.5 and go 4 years of undergrad. Every year was the same number of credits. I had a 3.0 freshman year, 3.0 junior or sophomore year, 4.0 junior year, 4.0 senior year. That's 2 years out of 4.0. The 2 years out of 3.0, they even out. That's my 3.5. So that looks great. It is other trends that I just don't know about yet, whether or not that works. How many classes are science? What is your science GPA? It's fantastic you have an upward trend. I'm glad we're using that language. It's important, but there's still some more data in there that I would need to look at to understand. 6,000 plus clinical hours, fantastic. Consistency and recency. If you have 6,000 hours and you're done and you're not doing it anymore, the action, right? Your actions say, hey, like, I'm done. Don't want to do that anymore. I literally was just talking to a parent of 2 pre-meds, actually. There was a whole family, two kids and 2 parents. Both parents are doctors. The dad was on an admissions committee at the institution where he works. And he said, we will get students with really good GPAs, but not enough clinical experience, and they don't really know why they want to be doctors. I'm like, yeah, that's why we talk about clinical experience so much. It's super important. Kevin, over on YouTube, is there any real merit to medical school ranking? The only real benefit I know is top ranked schools have reserved seats for residency. Kevin, top ranked schools have reserved seats for residency. Kevin, I want to challenge your language there. Let's rephrase. There are some schools that have reserved seats for residencies. And even that term reserved seats for residencies, I don't like that term. Kevin, I would love to know exactly what school you're talking about. The one that comes to mind is NYU. I don't know if that's the one you're talking about. I'm going to answer the first part of the question. Is there any real merit to medical school ranking? No. I unfortunately, over the last several weeks, have this. I've been ruminating, which is normally a bad thing. I've been ruminating about med school rankings. And I think at some point, I want to take a shot at creating rankings that I think are actual indicators of the potential academic institution, environment, education, opportunity that a student has at a school. So I may be taking that on. If you want to help, come help. But if you don't know, I despise U.S. News and World Reports. Their methodology is complete trash. It is based off of factors that just don't matter to an education. I think the one kind of indicator in their methodology is faculty to student ratio, which sure, a lower faculty to student ratio, or a higher faculty rather, faculty to student ratio, you would assume would be better. Although a lot of those faculty members are hiding in their research labs. Although nowadays with research funding cut, I don't know. The KT28, 4.0, 2.5, 3.5, 3.8. Yeah, so you have one bad year. So when you look at trends and go, okay, my my overall GPA is 3.49, but when we break it down to say 4.0, 2.5, 3.5, 3.8, you had one bad year. And it was your second year, not your last year. Fantastic. Probably don't need a post-bac. That's great. What about taking a 5th year for financial aid reasons instead of a formal post-bac? Ultimately, at the end of the day, if you're trying to improve your grades and to show academic readiness, it doesn't matter how you do it. Community college, delay graduation, take a 5th year, all that stuff. Am I reading YouTube comments? Of course I'm reading YouTube comments. There's lots of questions coming back and forth. Awesome. Any advice on how to get in the same place as each other? Oh, that's the second part. I've had a girlfriend for 5 years now, and we want to go to the next step, but we both want to go to medical school. I would recommend looking at locations where there are several medical schools in that area. For example, New York City. There are lots of medical schools in New York City. You don't have to go to the same medical school, but you can live in the same place, be together, and go off and take the subway to whatever medical school you're going to, and then go. So that's what I would look at. Outside of that, try your best. I always tell a story of 2 students who I don't think they were married yet. 2 students, they met in a master's degree program. Marvin just got my UCI Prime interview. Congrats. That's fantastic. 2 students, they met in a master's program for music. They both fell in love with the healing part of music. They were doing like music therapy. It wasn't their plan to go to medical school. They both fell in love with it. They both applied to medical school. She got in to, I think it was Wake Forest. He got rejected. He then sent a letter to Wake Forest and said, hey, I would love for you to reconsider my application. My girlfriend, fiance, whatever they were at the time, just got in, and they reconsidered his application. He had an interview and ultimately was accepted. So you can always advocate for yourself. Kruti, hello. Wanted to pop in and say hi. Hope you're doing well. I hope you're doing well. Stop falling off of chairs, please. I'm a PGY1. I applied in 2020. You kind of gave me comfort during quarantine. Thanks for all you do. Awesome. Drans, fantastic. I love it'd be interesting when I'm when I'm older. I'm older now, but when I'm like older and going to the doctor all the time, like how many doctors would be like, hey, I know you. You're the YouTube guy. It happens now, which is kind of unfortunate. I'm like, I just need to get my, like, I'm getting my colonoscopy in my first colonoscopy. I'm 45, so I get my first colonoscopy next month, and I'm like, any pre-meds here? Gonna look at yeah. Anyway, we don't need to talk about that. Just remember HIPAA, my friends. HIPAA's my friend, at least. Oh man, let's go. All right, let's see. Scrolling through some questions here. Oh man, MappdCon.com this Saturday 9 to 5. It's free. Go register. I'm doing 2 panels, moderating 2 panels, an MD admissions panel, a DO admissions panel. I have the Dean of Admissions from NYU, Dean of Admissions from Vermont, Director of Admissions from University of Florida. Go Gators. And then for the DO panel, we have VP of Recruitment, Bill King from VCOM. We have Stephen Davis, Director of Admissions from Toro, California, and Natalie Davis, Director of Admissions from Burrell College of Osteopathic Medicine. So come hang out. Kartik, when asking for letters of rec, can I just ask my professors and they send it to me and then I attach it to my AMCAS, or do they have to submit it separately in a way where I'm not supposed to see it? Yes, the latter. You're not supposed to see your letters of recommendations. They are supposed to be confidential. I was talking to a student today who said that her pre-health office screens letters. So the letter writer sends it to the office. The office then says, this one's good, use it. This one's bad, don't use it. And I kind of cringed. I'm like, That's not really ethical. That's not what they should be doing. So it's kind of interesting. So there are a couple ways to do it. If you are part of our Mapped platform, which is where you go and you track all of your courses, your activities, start building a school list, you can have your letter writers upload letters directly into that. We screen it to make sure we QA it, make sure it is on letterhead, is dated, has a signature, and has contact information. And then when you're ready to apply, we then send it to AMCAS and ACOMAS. We're still working on TMDSAS, but right now we'll send it to AMCAS and ACOMAS. Otherwise, you wait until May when the application cycle opens up. You then request the letter directly from the application, and then the letter writers upload directly into the application platform. Can you please explain how clinical hours are viewed? I feel like I can articulate why I want to be a physician based on my current experience, but I always hear about number of hours. I don't really understand your question. I think if you have 5 hours and you're like, I can explain why I want to be a doctor, no one's going to believe you. If you have 50 hours, maybe they'll believe you. But at some point, there's diminishing returns on hours. And so what happens, unfortunately, is a lot of people just chase hours, try to get as many as possible. So yeah, I need a little more in that. Like, how many hours do you have? Is that enough? All that stuff. I also don't really believe in saying, oh, you have enough hours, because what you don't want is the perception of checking a box. And so if I say, get 500 hours, and you're like, great, I have 503, I'm done. The medical schools are going to be like, what do you mean you're done? Don't you want to be a physician? Don't you want to be around patients? Don't you want to be around medicine and healthcare? And so for me, consistency and recency are just as, if not more important than total number of hours. Any advice for high schoolers interested in medicine and BSMD? I don't believe in BSMD. I don't think BSMD should be a thing. High schoolers should be high schoolers. Go be a kid and start to learn how to be a human being, and go to college and apply to medical school later. Most BSMD programs don't have any benefit to them. You are still taking the MCAT. You still need good grades. We work with a lot of BSMD students who end up applying elsewhere, even with their BSMD acceptance. They go through the process and they're like, I have a 3.9 GPA. I got a 520 on my MCAT. I would love to see where else I can go. So they apply elsewhere anyway. When it comes to the MCAT, there's always talk about cutoffs for section scores. If someone has 129 scores in every section except one where it's a 125, damn you, cars. Does that hurt your application? I wouldn't worry about it. I would not worry about it. Any last minute advice for the MMI? Have it on Tuesdays. Yeah, treat it like real life. Look at the scenario and go, what would I do in real life? The scenarios are just super forced. Any advice for the interview tomorrow? Have fun, have a conversation, treat it like a conversation. It's not an interrogation. You don't have to sell yourself. Just show up and enjoy yourself. Have that good conversation. Advice for high stat, low EC student who became pre-med in junior year. It really depends on what that low EC is, but the thing that we see year in and year out are high stat students not getting into medical school because they don't have enough clinical experience and they can't explain why they want to be a doctor. So oftentimes, if you just figured out you wanted to be a pre-med, junior year, take a gap year. Finishing up secondaries, feel like I've struggled with my passion. Sounding repetitive. Any advice? Just make sure you're answering the question as best as you can. Is it bad to have a political stance or an activity that portrays a political stance on your application? I'm not worried about it. I think at the end of the day, right, we had terrible stuff happened yesterday. If you don't attack the other side, if you approach something with empathy and compassion, right? We can have a discourse and discussion around things. At least historically, we've been able to. That's where I think it's appropriate to have on your application. You have two options. One option is hide any sort of thoughts that you have that may point toward your political affiliations or beliefs or faith or whatever. You can hide that, and then you might end up at a school where now you have to hide it for 4 more years. Or you show who you are and you get rejected by some schools because of that, right? Maybe they'll never tell you why you were rejected. They'll never point to why you were rejected and that it was your political affiliations and your Planned Parenthood volunteering or whatever. But at least the schools that you get interviews at, the schools where you get acceptances at, you know that you were authentically yourself on your application, and therefore you are very likely going to be able to be authentically yourself at that institution and in that community. There still may be students and faculty that have a different stance than you. That's normal. What happened yesterday in this country, unfortunately, is not normal. It seems to be becoming more normal, which is horrendous and scary and all that kind of stuff. But yeah. Oh, thoughts on Hampton or Genty? What's Hampton or Genty? I don't know. Give me context there. What do you think about me taking the MCAT 3 times? 505, 507, 513, 514 hurt my app. I have 4.0. Fantastic. Go for it. If it hurts your app at some schools, oh well. You have a 514, 4.0 GPA. Fantastic. Move on. Don't worry about it anymore. Any advice for mid or low stat waiting for MD interviews? What do you consider mid or low stat? At the end of the day, if your academics don't show that you are not an academic risk, medical schools aren't going to take a chance on you. Right? We can talk about holistic admissions all we want. The first thing a medical school has to determine is, are you academically qualified to pass medical school? And if they don't have that sense based on the data for that school and the support at that school, then they're not going to accept you. So a low stat student, for me, you may need to do a postbac and have an upward trend. I still haven't gotten an MD interview, and I'd say I'm a strong applicant according to ChatGPT. Can we not use ChatGPT to determine if you're a strong applicant or not? People are putting way too much faith into ChatGPT and what it knows or doesn't know. I use ChatGPT almost every single day. I love AI. It is not smart. We are working on, at medical school headquarters, some stuff for AI, for essay editing and some other fun tools, but it will be trained based on our knowledge. ChatGPT isn't trained on an admissions committee's knowledge. So you can't just throw your application at ChatGPT and go, am I a strong applicant? It doesn't know. It may have looked at some of the AAMC PDFs and said, here's what the averages are, blah, blah, blah. But that, like, I don't use those to determine who's a strong applicant, who's not. I can just say, oh, based on your GPA and your MCAT score, this is the percentage of students that were accepted last cycle. That doesn't tell me if you're strong or not. So got to use ChatGPT more diligently. Do medical schools care about prereqs from community college if you're a career changer, postgraduate? I would say big picture, no, not a problem. I started working as a PCA at Ohio State at the beginning of May. I work roughly 16 to 24 hours a month as I prepare for the MCAT in January. So a rough conservative estimate, 500 when I apply. Awesome. Keep going. that's consistent, it's recent, keep it going through the application, whether it's that experience or something else. Good job. Does post-bac 31 hours 4.0 help an upward trend for a previous GPA of 3.35? Absolutely. 31 hours at a 4.0, fantastic. Fantastic. I've been using your vids for the past few months now, using for interviews. Thank you. Woo! Someone asked earlier, how do you apply to be on application renovation? I'm not sure if I'm going to keep doing mission accepted. You guys tell me. I guess I can. But it's medicalschoolhq.net/apply is how you can apply to be on those. It is one of my, we have MappdCon this weekend, right? MappdCon.com. This Saturday, come to that. Again, I'm moderating two admissions panels, Dean of Admissions at NYU, Dean of Admissions at Vermont, Director of Admissions at UF. So if you're interested in those schools, or just come and learn. And then for a DO panel, I have the VP of Recruiting for VCOM, Director of Admissions for Toro, California, Director of Admissions for Burrell College of Osteopathic Medicine. And then I'm finishing the day with the real TikTok doc, Dr. Ricky Brown. We're going to do a little fireside chat together talking about healthcare and the future. So, all right, my friends, I do have to run. I'm off to the hospital to go say hello to my nephew who was just born today. So I hope you have a wonderful day. What's up, Joshua? How's the bowling going? Hope you're doing well. MappdCon.com to go check it out. Have a wonderful day. I'm going to try. I keep wanting to do TikTok lives at night. How, like, or YouTube. I can come on YouTube too. Like, how late is too late? Because by the time I get my kids to bed and I come on here, like, how late is too late to do some TikTok lives? I know when I'm doom scrolling TikTok at night, I'm like, there's people doing lives. I guess people are on. What time do you guys go to bed? If I were to come downstairs and 1 a.m., that's too late. All right. I mean, it'll be, people are on super late. Yeah. All you guys need to go to bed. 12. It would probably be like midnight Eastern. So I'm Mountain time. So it's like 10 p.m. my time. So yeah, I don't know. We'll see. I'll try it a couple times. Check it out. All right, friends, I got to run. Take care. Have fun. I'll see you later. Keep breathing. Everything's going to be okay.